On the 27th of February 2020, Nigeria announced its first case of coronavirus. And tomorrow, June the 6th, will make it our 100 days in the battle against the coronavirus pandemic. Now, more than 11,000 cases have been recorded and more than 300 people have died from COVID-19 related complications in the last 100 days. But Nigeria is yet to reach its coronavirus peak, even as the government battles to flatten the curve. Joining me now via Skype is a public health specialist, Dr. Nseabasi Ekanem. Dr. Ekanem, good morning. It's good to have you join me. Now, the World Health Organization with the Ministry of Health, as well as the CDC, as well as the Commission of Health in Lagos, at one time or the other have made comments as to the fact that the cases of coronavirus can be worse going forward. Now, Nigeria has not reached its peak yet. From the numbers, the way they're coming, they're rising on a daily basis. It's going to be 100 days exactly tomorrow. What are we doing and what are we not doing?
Okay, I would say that it's quite interesting that tomorrow we are marking the first 100 days after the index case was reported in Lagos. I must say that, first of all, what we haven't done that we got all this far is the fact that there was a delay in response. It was absolutely necessary that as soon as the first case is reported in Nigeria, that we should have shut down our borders or at least strengthen our disease surveillance at the port of entry. Unfortunately, that wasn't done on time. The shutdown, which was done, was not transmitted across all states, and there were varying responses in terms of preparedness and action plan against COVID-19, which has really led to a lot of community transmission of the virus. Well, we are here, 11,000 and counting cases, but I think what we should do in the coming weeks is we should first of all let Nigerians understand the fact that we have not even gone to our peak. A lot of Nigerians up till today still do not believe that we have this virus, honestly. And that shows that there is a gap in terms of disease risk communication. It's important that we work with more grassroots community-based organizations to educate Nigerians. Now, the prevention of COVID-19 is the duty of all Nigerians, because by keeping or by adhering to the precautionary measures, we can help to cut the chain of transmission. So we need to tell more Nigerians, let more Nigerians know about it, and still strengthen our facilities to be able to accommodate more cases that we are going to be having in the next coming weeks.
All right. Now, several people had blamed the government for not shutting down the country on time. But the point there is we're here where we are right now already. We can't talk about that past anymore. But right now, as the numbers are increasing, we're talking about there are protocols already for the opening of the economy when it comes to churches, when it comes to mosques, when it comes to schools. There are projections already as to the timetable for schools to resume, aviation to resume, and all of that. So is that the right decision to make right now? Although some persons have said that certainly we can't keep the country locked down for so long. Talk to us how difficult it is to make that decision at this time and what should be the best.
Well, the truth is that it's a very, very difficult decision to make, but it's an obvious decision. We cannot continue to keep the country on lockdown, especially the economic activities. So I think it's a right decision for Nigerian government to intimate Nigerians right now that we have the plans to open these facilities. And this is the time for Nigerians to be prepared. All these facilities like the churches, the mosques, the aviation industry, they need to put modalities on ground. The idea is to ensure that we reduce person-to-person transmission, whether in the church, in the mosque, or in the airplane. Here, we need to ensure that we strengthen our surveillance system. And of course, we educate whether our worshippers or people boarding airplane on how to abide or adhere with the precautionary measure. Respiratory hygiene, hand hygiene, And of course, social distancing is very key. Now, religious organizations are told to ensure that they don't exceed 40% of their capacity. This is in order to maintain adequate social distancing. This information must be transmitted to all members of whether the church or the mosque. Every other institution like the school that will open in the future,
Okay.
children must be also let to know this. So we need to prepare Nigerians, we need to prepare everyone towards this, the reopening of these facilities and how they can prevent person-to-person transmission. That's the only way we
Okay.
can tackle.
All right, we have to leave you here now. Dr. Nseabasi Ekanem, thank you so much for your time on the program. On the 27th of February 2020, Nigeria announced its first case of coronavirus. And tomorrow, June the 6th, will make it 100 days in the battle against coronavirus pandemic. More than 11,000 cases have been recorded and more than 300 people have died from COVID-19 related complications in the last 100 days. But Nigeria is yet to reach its coronavirus peak, even as the government battles to flatten the curve. Joining me now via Skype is a public health specialist, Dr. Nseabasi Ekanem. Dr. Ekanem, it's nice to have you join me now. Now, there seems to be some level of confusion as to the approach and some of the protocols put on ground. Now, WHO had notified that the chloroquine can be used as one of those drugs on trial to see if it can record any breakthrough in or reducing the number of days that people who contacted can have. But they announced a suspension after some time, and then they're bringing it back again. What signals does this send to people across the world when it comes to the direction of things?
Well, the truth is that the decision of the World Health Organization to halt the solidarity trial for hydroxychloroquine was born out of the reports of an increase in mortality with people who used the compound. And at the point it was halted. But, during therapy, it is often advised that people who are on trial should continue and complete a particular trial period for a particular drug, such that the efficacy and the safety can be fully assessed. Unfortunately, the WHO halted it. And because of that, we could not be able to say exactly how the drug, impacted in the lives of the people that took it. Right now, there's a need for a resumption because there is need for us to conclude that trial, for us to be able to say categorically that hydroxychloroquine is effective or not effective, or whether it is safe or not. It seems like there is a confusion, but actually there is actually none. The issue is that those that were on trial, that began the trials, have to complete it so that we can fully assess the efficacy and the safety of the medication. And once that is done, then we can come up with a report on whether it should be used for the treatment of COVID-19 worldwide.
All right. More people are concerned with issues of self-medication. In fact, by the mention of chloroquine, there are lots of people just rushing into chemists and pharmacies looking for chloroquine to take and are self-medicating at home. How dangerous is this?
It's very, very dangerous. Hydroxychloroquine is one drug that is known for a delay in what we call QT interval, which could lead to severe heart conditions. Unfortunately, with the chaotic system in Nigeria, one can easily go into any pharmacy and pick up a prescription medication because chloroquine or hydroxychloroquine remains a prescription medication and it's supposed to be administered only with the doctor's prescription. Unfortunately, when people buy it, they do not even know the dosage that is effective for the treatment of COVID-19. So they are bound to take higher doses, and at the end of the day, it may result in very, very severe cardiac complications. And that's why every Nigerian must desist from self-medication with hydroxychloroquine because the complications can be quite devastating.
Okay, we have to leave it here now. Thank you very much, Dr. Nseabasi Ekanem, for your time on the program.